Today we're here with Teresa Beekle, a registered sleep technician at Endeavor Testing Center. Teresa is here to introduce you to the ResMed ApneaLink Air Home Sleep Testing device. This is the device that the QuadMed clinics will be utilizing with their patients. Teresa is going to walk us through the different parts and how to put it together for patient use. She is showing us the device itself, the reusable Velcro patient belt, the Easy Sense respiratory effort sensor, the pulse oximeter pod, this is the piece that goes into the unit, the non-disposable pulse oximeter, the clip, the USB cable with a mini port that goes to the device and a regular size port that goes to your computer, the carrying bag. This is how the patient will be taking the device to and from home. She's going to start by putting it together. On the back of the device, there is an opening for 2 brand new AAA batteries. Every time a patient uses this, it needs to go out with 2 brand new batteries. Then she will thread the patient Velcro belt through the unit. She's going to have the non-Velcro side facing her with the unit facing down. There are 2 loops, one on each side, that she will thread this through. Just thread, pull, she is now going to get the Easy Sense respiratory effort sensor. There's a loop on this as well.
You want this facing downwards. You want to put the loop through like that, and then close the Velcro. Then you want to pull the device over the Velcro opening so you can't see the Velcro to open it. Then you're going to want to attach the effort sensor to this bottom port here. You just screw it in. Then next,
she's going to get the pulse ox pod.
The pod.
Teresa, will you show them that there's a
little slit in the pod right here, and there's also a little slit here. You just line them up and then snap it into place.
You want to be able to push directly in and pull directly out so you don't bend the pins.
Then you want to see that the pins are lining up. There are 4 in one row, 5 in another on each one. So you just line that up correctly and push that together. Then you're going to want to put the clip on.
The clips are a little stiff when the unit's new. It'll give.
And the last thing, we are going to attach the cannula to the last connector here.
And every patient, of course, will have a brand new cannula that is put into the bag and onto the device when they take it home. That cannula should never be put back into the bag. The patient should be instructed on taking that cannula off at the end of their study and throwing it in the garbage can. Teresa's going to then put the belt on. The belt for a male should be directly over the nipple area. For a female, it should go above the nipple area. The belt should be pulled snug, not real tight, not too loose. It's comfortable. Next, Teresa's going to put the cannula in her nose. The cannula is going to be inserted with the prongs pointing down towards the back of your nose. Looping the plastic tubing around your ears, pulling the slider up towards your chin until the plastic tubing is secure and comfortable. 2 pieces of tape can be put on the cheekbones so that it stays in place for the patient. The non-disposable, reusable pulse oximeter glove should be placed on the non-dominant hand. Index finger or middle finger works fine. The cord is on top of the hand. Another good thing to do with this is to have a piece of tape so the patient can tape it right on top of their hand as well. Teresa is now putting the clip on for the pulse oximeter. It should slide right onto the belt. Again, they're stiff when the unit is brand new. Now you want to make sure all the connections are there. The effort sensor tubing is not pinched. The cannula is not pinched. All right. Then next, Teresa is going to turn the device on.
So you hold it down for approximately 3 seconds or until the light comes on, then you remove your finger so you do not shut the device back off.
As you can see, each of the connections have a green light. That means it's ready to go. If there was a red light at any of the connections, say by the pulse ox, the patient might want to look and make sure that their arm is not bent or their hand's not crimped, and drop it down to their side to see if they have a connection. Circulation is different on everybody. This device is now ready to go. The patient now can go to bed. And the patient should be instructed that when they wake up in the next morning, they turn the device off by pushing their finger onto the on-off button right in the center of the device
For approximately 3 seconds.
for 1 to 3 seconds.
Then the test complete light comes on. It's red because we only had it on for a few minutes. It should be on for about 4 or more hours. Then to turn the test complete light off, we do push and hold it down about 3 seconds again, and then the light comes off.
If your patient did have an incomplete red light on, they should be encouraged to take it again the next night. So not to throw out the cannula, to keep everything put together. The batteries are good for 2 nights in the unit. You may want to give an extra set of batteries in the bag for the patient in case they have to take it a 3rd night. Again, the unit can run for 2 nights on the first 2 AAA batteries. A 3rd night would require a fresh set of batteries. If the patient has a green light, they should be instructed to take the device off, to turn it off, take the device off, to unscrew the cannula, throw the cannula in the garbage, and put the rest of the device back in the bag and take it back to the QuadMed clinic.